host for this next segment of our show. And she is Dr. Dawn Gillette Crossan, is a native of Philadelphia, PA, and completed her undergrad and master's degree from the Pennsylvania State University Park, Pennsylvania. She later obtained a second master's and a doctorate degree in clinical psychology from the Philadelphia College of Osteopathic Medicine. She is a licensed psychologist trained in cognitive behavior therapy, CBT, and is a certified trauma therapist and has been in the field of psychology since 1996. Dr. Dawn has a vast array of experience with human services and working with at-risk children and youth. She is a noted trainer and has taught post-secondary collegiate classes at Phoenix University and Messiah University. She's provided trainings for Dauphin County for over 10 years on topics focusing on understanding the mental health disorders of the populations most served. Dr. Dawn is currently the sole proprietor of an outpatient office, Petra Psychological Services, LLC, and the clinical director and founder of the Harrisburg Area Learning Academy, Incorporated, that includes an intensive family-based trauma-focused cognitive behavior therapy program and a trauma recovery center, TRC, in Dauphin County. She also serves on the Adverse Childhood Experiences ACE Executive Committee, providing trauma-informed training to agencies and the community throughout the county of Dauphin. Thank you so much, Dr. Crossan.
Hello. Thank you for having me. Let me just start off with this has been an amazing time. I wasn't able to be on the whole time, but what I've been witnessing so far, it's been awesome. And I am so honored to be a part of this celebration with my brothers and sisters across the African diaspora. So again, I want to thank BMHM for asking me to host and allow me to be a part of this. This is an exciting day. So now I'm going to do some introductions. We have a wonderful, exciting lineup today of panelists that we're going to be discussing persistent post-traumatic slave syndrome, but also persistent slave syndrome as well. So we're going to be talking about that today. So I'm really excited about this group. First up, we have Dr. Raquel Martin, PhD, HSP. She is a licensed clinical psychologist that holds her PhD in medical and clinical psychology. Dr. Martin completed her internship and postdoctoral fellowship at Johns Hopkins University Kennedy Krieger Institute. Dr. Martin has published research regarding mental health disparities and health equity. Her research and clinical interests include child and adolescent mental health, trauma, minority health disparities, and racial identity development. Dr. Martin is currently the clinical director at a residential treatment center for children and adolescents that have experienced traumatic events. She has experienced conducting individual, family, and group therapy with a focus on racially based stressors, trauma-informed care, and racial identity development. Dr. Martin's experience as a psychologist, researcher, and professor make her the perfect fit to discuss the intricacies of the Black experience, trauma-based interventions, coordinating community resources, and coalition building. She prides herself on being a mentor, educator, and advocate for the next generation of clinicians. Welcome, Dr. Martin.
Awesome, thank you.
Awesome bio, and I can't wait to hear from you. Can't wait to hear from you.
I'm from Philly too, by the way.
Oh, woo-hoo, Philly in the All right, I am not alone today. Okay, awesome. Next up, we have Sister. Now, I'm going to try my best with this name. Please forgive me, all right? Sister Oloruntoyin.
Sister Oloruntoyin.
Oloruntoyin, yeah. Oloruntoyin, beautiful, is a certified psychosocial counselor committed to addressing the mental health needs of the African diasporic communities with a focus on empowerment in psychology in cultural contexts and African knowledges and indigenous practices. She is a Yoruba singing and performance artist and member of Arivati Arivati, an African collective that uses art as an instrument of resistance and develops strategies for emancipation, decolonization, and community care. She has more than 20 years of experience in the self-organization of Black interest groups. She is also co-founder of Black Community, Coalition of Justice and Self-Defense, a self-organization for social justice. Welcome. It's so awesome to have you.
Thank you. Thank you so much, Sister Dawn.
And I am looking forward to hearing from you as well. This group, this lineup is wonderful, guys. I think this is the all-star right here, all-star lineup. Next, we have Dr. Kevin Washington, Moati Kairi, PhD. Okay, is an African-centered psychologist licensed in Florida and Washington, D.C. He has taught, lectured at several colleges and universities nationally and internationally. NBC Universal BEN, National Alliance to End Homelessness, Roland Martin, Nick Cannon, Boris L. Henson Foundation, Essence, and many other national and international organizations have sought his expertise on Black psychological matters and leadership development. He is a past president of the Association of Black Psychologists and is currently an associate professor and head of sociology at, let me get this right now, I'm gonna mess it up, Grambling State University, and he is the National Director of Black Marriage Day. Kevin Washington received a bachelor's degree in psychology from Grambling State University and a master's degree in educational psychology, as well as a doctoral degree in counseling psychology from Texas A&M University. As a Fulbright Hays Scholar, Kevin Muwata researched the impact of socializing institutions on the healing of restructuring of post-apartheid South Africa, Azania. He worked with scholars from the University of Cape Town, University of Fort Hare, University of Durban, Westfield, and University of Zululand, KwaZulu, Natal, and others. He has conducted leadership training for students, faculty, and administrators, and continues developing leadership models that is grounded within a cultural competent framework. His expertise in multicultural African-centered service delivery. All right, awesome. Welcome. I believe he is still logging on. And you know, with technology, guys, we're going to be patient because anything can happen, right? It works when it works. Next up, we have David Nabaade. David Nabaade is a student of the University of Cape Coast, Ghana, pursuing health services, education, pursuing health sciences, education, psychiatry. He holds a diploma in community mental health from College of Health and Wellbeing, Kintampo, Ghana. He is the current national president of Ghana National Association of Community Mental Health Officers. Now, David is offline right now, but we just wanted to make sure we recognize him briefly, okay? All right, so I think we are ready to start. Okay, ladies, so we have an interesting topic. I think it's a powerful topic. I had the opportunity to read Dr. Joy DeGroy's book on post-traumatic slave syndrome. That was a powerful, powerful work. So let's jump in. Who wants to start off with this excellent topic? You're on mute, Dr. Martin.
Wow, that's the first time. Which aspect did you want to start with?
Well, what do you feel is most resonates the most with you? I was looking over some of the pieces, and one of the things that I thought that stuck out the most is the symptoms. But let's define the syndrome first. How about we do that for our listeners so that we can have a groundwork, just in case someone is not familiar with it.
Yeah, so as the novel states, it states that as someone who read the novel, I am not the doctor who developed this theory of post-traumatic slave syndrome. But what I got from the book was that the contributing factors are multi-generational trauma, combined with continued oppression, which individuals in the Black community, of course, can understand, and the absence of opportunity to heal or access the benefits of the society, which lead to the syndrome. It's basically the aspect of being enslaved Africans in America, the continued oppression of Jim Crow and systemic racism within every single aspect of where we are in America, as well as the world, and then the lack of opportunity to heal from that, right? Like the acknowledging or not acknowledging the fact that it did happen, even just simply changing language. Instead of saying slaves, slaves were not brought from Africa, enslaved Africans were brought from Africa. So even just invalidation in that way prevents the opportunity to heal, or the absence of opportunity to learn about your own heritage. We go to school and we learn about Columbus and many other individuals, and we don't learn anything about our own heritage, which
Exactly.
is the opportunity for us to heal or access benefits that are available to the society as a whole. The whole aspect of it is systemic, which in fact leads to the post-traumatic slave syndrome.
Yeah. And so for the listeners, we're using persistent traumatic slave syndrome and post-traumatic slave syndrome interchangeably. So just so you guys know, it's the same, pretty much the same thing. You know, it's amazing that you brought that up, Dr. Martin, because one of the things that I remember in her book early on in the beginning of the book, she talked about taking a trip to South Africa and how when she got there, how they were interacting and how it was different there. And she asked, because, you know, they have this, you know, they have a very heinous background too in terms of oppression and things of that nature. And she asked one of the natives there, what made this different? Why is it different here? And he was like, well, we know we kind of passed that. It was South African that she asked us to. And he was like, well, we kind of passed that now. It was horrendous. And, you know, we recognize that it was horrendous, and they acknowledged, South Africa made some acknowledgments. And I know it's not all perfect there at all, but what you brought up was powerful. The fact that there was an acknowledgement that there needs to be a validation of what has happened. And we have yet to see that in our country as a whole from the leadership, you know. So I definitely agree with that. Sister, would you like to jump in? Did you have anything that you want to bounce off or add to that conversation?
Yes, I totally agree with that. You know, that in our tradition, like when you say there has been a trauma, there has been an injury. And if you look at one of the first steps in overcoming it is actually the acknowledgement. Mm-hmm. The acknowledgement that an injury has taken place. Mm-hmm. And then you can start moving on to ways in which one can try to make this situation better. Yeah, what can one do to heal? Mm-hmm. Mm-hmm. So often we remain in this state because even the injury has not been acknowledged. Yeah, in another history is being told. Yeah, yes. The histories of the imperialists is always being told.
Yes.
Yes, yeah. And in part of this, you can notice this with the low self-esteem, which affects our people. You can notice this in feelings of anger that one can't even express why sometimes, mm-hmm. You know, mm-hmm. And all these kind of we're raised and socialized in a racist system, even in the continent. Mm-hmm. Yeah, there is an internalized racism already.
Yes.
So definitely there is a lot which can be said, but I think these points which you mentioned are already very important.
Definitely. Yeah, definitely. Yes. You brought up some of the symptoms that is listed in the book in terms of how do we know that this is impacting us, and one of it was vacant self-esteem, ever-present anger, race and racist socialization. You know, and I think about. I'm like, I don't know that I know any brown person that doesn't, to some degree, demonstrate these symptoms, you know, in my professional work as well as within my personal work. But I think the book really highlights some things that may even be subconsciously happening within our own families. You know, when I read the book and I think about this syndrome in general and gather information, I can see some of the impacts of that coming out in my home as a child. And I'm sure my mother wouldn't have identified it as that, but listening and reading in the literature, I'm like, that's what that was. That's what that, exactly. Even in my own parenting, or even as a therapist myself, you know, did you either one of you want to share some of the things that you've observed personally or professional with this type of, with this situation or with this syndrome?
I think with every single aspect of working with Black children, because I work primarily, most of my experiences is with community mental health, incorporating racial identity development from a strength-based perspective. So many times you look into these models and they're looking at it from a deficit aspect of it, right? Like something that you need to improve. But when it comes to racial socialization, it doesn't only have to happen in the school. One, there needs to be an improvement of it in the school in the first place. But some of us don't have the opportunity to take our children to these schools and go to these school board meetings and make sure stuff are changed. So it also happens within the home. So when I'm working with families and individuals, we talk about racial identity development. We talk about where they are and what stage, because there are different stages of racial identity development when you feel as though you know a certain aspect about your community and your environment, and certain times when you don't, or you don't feel comfortable taking into the fact that there are just insidious aspects of propaganda within the media, where children may not be used to seeing themselves in a positive light, right? Exactly. Children are used to being looked at in terms of the deficit aspect. Children aren't looked at when it comes to the strength-based approach. So even being able to address the fact that vacant esteem is present, even being able to address the fact that you may have a marked propensity for like anger, but it's not like that isn't valid. I can't imagine anyone being incredibly happy all the time when every single perspective or every single person is constantly speaking negatively about them. Every time they see someone like the media, or either get shot or screamed, or they're, selling drugs or, doing something like that. Like, there aren't enough positive aspects in the media.
Yes.
And I feel like this is changing over time, right? Like, I think it's amazing that this is a time where we're able to have more access to that, but that's not always the case for everyone. And that's where things get passed down, right? Like, if you were at a time, you're older and we didn't have Blackish, or you didn't have, at some time all you had were like the Cosby Show and Family Matters. What if you didn't identify with that? I feel like social media provides an opportunity and other aspects, even like this program, to have more helpful racial socialization. But it shouldn't be something that's tap danced around. If there's an aspect of mental health, you can't talk about mental health within the Black community without talking about the aspect of systemic oppression, racism, the destruction of Black bodies that supports and continues to support the finances within this environment. It's not possible. You can't talk about depression if we don't talk about the intricacies of vacant esteem and racial identity as a contributor to depression in Black individuals. Right? You can't act like we talk about even healthcare if we don't talk about racial and systemic biases within healthcare that make it so that people don't feel comfortable talking to these doctors or seeing them.
Right.
If you know for a fact that there may have been bias against you, it's not possible to talk about Black mental health without talking about systemic racism and putting an emphasis that race is not the issue. Racism is the issue.
Yes.
There's nothing wrong.
Yes.
The person, just not to get it confused. But sometimes people try to change, be like, we adjusted this modality by adding Black to it. It's a new modality, and you have to do more research on how it applies to us. Because when it comes to all these diagnostic manuals, we're not often thought of. We don't think the same or do things the same. We don't have the same opportunity. So why would we have the same modalities?
Exactly.
So acknowledging that and stop acting like, it's not there. It's there.
It is there. It is there. And it's so ingrained.
I've ever worked with. It's not present. Just being able to be a Black clinician, just being able to say, I understand being angry. I totally get that. Racism is awful. I get angry every single time. There's nothing wrong with that emotion. What are you going to do about it?
Exactly.
Activism? Are you going to try to change your community? Are you going to get involved in mentoring? Are you going to try to educate other people? What are you going to do with that anger? What are you going to do?
Right. And that's important. That's important. And it's so ingrained. It can be so ingrained within our societies, within our own homes sometimes. Colorism, texturism. It's pervasive. It's pervasive and it's ingrained. So I totally agree with you, Dr. Martin. So we want to welcome Dr. Kevin Washington to the platform. How are you doing this morning? Mawata Kaidi, how are you?
I'm doing well. I am in the Gambia. This is not me trying to brag or anything. I am homecoming Gambia, where we help people to actually renormalize themselves back into the Africanity. And so I was trying to find a good space to.
We're losing you there, Doc.
Begin to diminish. So I had to relocate to a space that is more open. And I apologize for that, because every now and then you hear background noises. But I think that may be a good thing, because the beautiful thing about it is that in this space, there is an element of humanity. And so somebody is going to stop and say, hey, how you doing? Going to ask you, how was your day? Did you rest well? And so that's a African humanizing experience that I think everyone should encounter. And so we have coming up this week, we have a Black Love Retreat, which is, again, if we understand that marriages for Black people African people were actually disrupted on the continent of Africa, then we must find ways to come back to a space to normalize ourselves into our beingness, where we were actually dislocated from this and experienced the trauma. So again, I regret the noise, but I'm not regretful of where I find myself, because this is an African humanizing moment.
Right.
So I wanted to add this. I don't hopefully that the sounds are not necessarily disruptive, but I wanted to say that one of the reasons why I conceptualize the concept of persistent enslavement systemic trauma as opposed to post slavery trauma. And as a matter of fact, Dr. Georgia Good and I were talking about this as she developed the concept. And I said very clearly then, and I said now, that you can't have a post moment when it's ongoing. You can't. Post trauma means that you're beyond the trauma.
Yeah.
So once you're beyond the trauma, then you can have post. So we often use the oppressor's conversation or discourse to describe our African reality. And I think that you said it very well, Dr. Martin, is that you cannot simply blackanize concepts or constructs. You must be grounded within your African reality. So we say persistent means that it's ongoing. George Floyd, Ahmaud Arbery, those things are persistent phenomena that continue that we encounter. Enslavement, not necessarily the issue of the physical enslavement, but the ideology of enslavement, which dehumanized African people. The idea that there is a superior and inferior group, the idea that there can be white and then there's the other, right? That is the enslavement ideology. Systemic means that it runs through everything that we encounter and you all said it, systemic racism. You mentioned about schools, you mentioned about what we name our children, the foods that we eat, the clothes that we wear. All of these things are perpetual moments of trauma where we decide and discern how we're going to navigate a space, and thus the idea of trauma, which is this disruption, and not trauma of a disruption of a physical nature, but for African people, what is
Yeah, I think we're having some spotty connection there, but he's pointing out some really powerful points, though, in terms of persistent versus post, and that is very important. The language that is being used, and how you said you just can't blackanize something. It has to be, it's something that we have to be mindful of, like rooted and grounded in the culture, understanding the nuances, because there are differences between people of color and treatment versus non-people of color, and it's important to understand those nuances to be able to treat effectively and to heal effectively. Sister, did you want to jump in? Go ahead, Dr. Martin. Go ahead.
Oh, I was going to say, I know when it comes to, and I think pronouns is also a thing, but when it comes to color, I always say Black, because I don't know the whole wealth of the people of color experience. Yes. I just know how my experience is with a Black woman. And I think a lot of times lately, and I'm all for inclusivity, but I think we need to also be specific, because there are many people in that aspect of people of color, but I'm talking about the Black experience. Now, it doesn't mean that it doesn't apply to them as well.
Right.
But it means I know who I am specifically diverting my to. When it's more general, I always say people of color. But when people, I'm like, I'm talking about Black. It may also apply to brown or anything else. But if it doesn't, I just want to say I was referring to Black specifically. Because I can lose that too when we say things broadly and then we get lost in the shuffle. And I also feel like we need to be specific too. And I know, some people don't refer to as Black, and everything's pronouns are different. But with myself and my culture, when I'm talking about it, I'm Black.
Right. Yeah. I do people of color and I do Black, because I have people of color and Black. I work with both and I experience both, and I am a person of color as well as African American. But I definitely understand where you're coming from, making it really clear in terms of what you mean specific. So I appreciate that. But I do both. So Dr. Washington, so you got cut off. Your reception is not that well where you're at. So sorry about that. You want to pick up where you were at?
Hey.
Yes, can you hear us?
So I think I heard microaggressions as well. Is that what? Yes, I can hear you.
Okay, good.
Can you hear me?
No, I don't. Yes, we can hear you. I was just sharing with you that your
reception.
Can you hear me? Yes, we can hear you.
Okay,
good.
Can you hear us? Yeah. All right. So microaggressions. I am challenged. I got the VPN. I've done everything. I've never had the reception problems with anything until today. But anyway, we will press forward. And it's a very sanitized term, because any aggression is aggression. I mean, is what it is. So we have to call it for what it is. It's a traumatizing experience, and so. We don't use European nomenclature to describe African reality. So I will pause more so that we can make sure that I'm being heard. Is I'm being heard? What was happening?
Yeah, you're going in and out. You're going in and out. So
That's terrible. And I have not had problems until today. So I relocated and I'm still having problems with it. All right. So I will try to find another location. And I will just give me a moment to find another location and I will get better.
Sounds good. Sounds good. Sister, it sounds like you were about to speak. What were you going to add?
Yeah, I was going to talk again and emphasize again about how deep this trauma goes and actually how early it starts. So that was a good point that was made, that it's not even only in the institution of school, but also in institution of family.
Yes,
yes. That already children as young as 5 are already feeling, I'm not good enough.
Yeah.
Or asking, what am I? Is there a purpose to my life?
Yes.
Already as young as 5, some even earlier. Yeah, that even in the family, parents are misjudging their kids as being too light or too dark.
Yes.
And we noticed already now in the talking, the construct of Blackness. Yeah? Am I Black? Is my identity based only on the color of my skin? But it has been, we're living in a system, born in a system, which is now racist.
Mm-hmm.
Yeah? So as opposed to Black in the capital letters, to say, yes, I identify consciously as Black because I realize I am in an oppressive system and I take a position of power and self-determination, joint self-determination, and identify consciously as Black. But normally in the African tradition, we are not identifying according to color.
Yeah.
Normally we would say, yes, humans, we're all the same.
Right.
But we're living in a violent system that puts people in categories even before they're born. And we have to understand that. So the first step is so important in understanding where are we in this world, and actually realizing that we cannot start early enough to even educate our children so that they understand these experiences that they are having. A lot of time people grow up and feel something is wrong with themselves, not realizing that the system is actually functioning in a way to oppress a certain group of people.
Yeah. Yeah. And again, it's ingrained year after year, generation after generation, when we think about, like I said, texturism, colorism, and the macro and microaggressions that, can occur just across. And like he said, we're making this language soft. We're watering it down. But the truth is it's an aggression, and just the noticeable differences within homes as well as schools, within the workplace, of how people are treated based upon the color of our skin, and within our color, but within our own race, the colorism and the texturism that stands out. I like how Dr. Martin had pointed out the racial socialization has to occur in the home, as well as the schools and as well as throughout our communities, but also in our homes. So Dr. Martin, what are some of the recommendations that you would throw out into, I have a few, but let's hear from you, that you would throw out in terms of socializing, beginning that socialization at a young age, because they notice it at a young age. And, I was babysitting someone, one of the children from the church, and they're biracial. The father is, the mother's biracial, the father's African-American. And so the mother's African-American and white. And the children they're brown, and they were saying something. They were talking amongst themselves. They're little. Nobody's over the age of 10. And the littlest one, she's like 5. She said something like, "Well, he's Black. He's Black." And she wasn't saying it, like he's Black. She was saying it like it was a bad thing. And I talked to her about it. I said, "What's wrong with being Black? Let's talk about that." But so young. No one ever said anything to her. Her mother said, we don't do that in our home, but she got it. She got it from family interaction. She got it from school, that something's wrong with being a darker skinned Black person. So Dr. Martin, what do you have for that?
I would say we really need to be more mindful of the things that we let our children ingest. You know, I say propaganda because it is propaganda. there's no aspect of it to, and I mean, and that's the way, I mean, and to delve deeper into it, that's the way that eventually, like when we were brought over here, that's the way that they decided to make it normalized for racism, for Africans. They began having propaganda to show that, you know, people can't imagine treating other individuals this way. So we have to say that they're lesser than. We have to have propaganda that shows vanity. We have to show propaganda that shows that their brain is small. We have to show propaganda that shows that, you know, we're doing them a service. That's, you know, it's propaganda. Don't think that any aspect of media is just there, because it's not. The reason why slavery was able to continue to go on, it wasn't solely about the aspect of, it was ingrained in the laws. It was illegal to free enslaved Africans. If you had to free, you weren't able to do it. There was propaganda stating that what else are they going to do? They can't understand our language and dialect. They actively separated individuals who could speak to each other. They made it so that you couldn't do it. I mean, there's no way to separate that. So it is propaganda, right? Like, so when you're looking at TV, and you're seeing people fighting on TV, and you look at the CEO, the people who make the decisions about what shows get put on TV, they don't look like us, you know? And versus when you look at this media that actually does look appropriate, that actually has that dialect, then they look like us. So be mindful of what they ingest, from TikTok to Instagram to commercials to all that. I also make sure that with my own son, every single book looks like him or me or his dad or his mom or his grandma. You know, like that's what we make sure it happens. It happens in every single aspect. When it comes to our verbiage, a lot of times we are, as Black people, parenting out of fear, and that's understandable.
Yes.
To be honest, there is a fear that you have when you're having a Black child that no race can possibly fathom. How long until my child is an adult? They're cute and cuddly now. How long until you see them as an aggressor? Right. So sometimes we are parenting out of fear, but we need to be mindful of how much we're balancing that. We're telling them, make sure, you know, you put your hands up immediately, you know, make sure you're on that, you are mindful of it, but make sure we also talk to them about the benefits of being a Black person, of having this collectivist society, of having the people that no matter what, you see a Black person in the room, you give them a nod, you see me, I see you. Okay. The strength of being enslaved Africans and still being able to contribute to me, being able to contribute to every single aspect of the world, like being able to be mindful of that. So I think there needs to be a balance. We need to make sure we're looking at the TV shows that they're ingesting, if they need TV at all, because I'm not a big fan of screen time personally, or the books that they're looking at, or looking into just how we talk to them, because there's so many individuals who, you know, are parenting out of fear, and we're telling them all these messages because we want to keep them safe. And I understand the reasoning for it. I totally understand, but you're scaring the heck out of them. And they're getting all of these negatives about, you have to do all these extra things that your white counterpart can't do, but you need to also talk about, and you get to have all of these amazing things that your white counterpart does not have. There has to be a balance. We need to make sure they're safe, but we need to also understand and speak strength into our children, and realize that, you know, everyone talks about generational trauma, but there's generational healing too. And running their family as well. You know, it just be a generational health club, you know, and just be mindful of that, because we take on what happened to us as children, like that aspect of socialization. So it could be back when I was a child, I wasn't able to do that. Think about how amazing that now that your child is, you have a child, they are able to do that. They are able to experience these different things. Speak empowering to your children. We are very mindful that as Black people, we don't get to do the same things. We may be looked at differently, but that shouldn't be the only message that we are giving our children. Because when I'm working with these Black teens, I get, it's like, sometimes we're dealing with these I'm dealing with these teen Black males, and I really feel like they are in the middle of just feeling like every time I see someone look like me, they're either getting harassed, we're getting followed in stores, I'm watching people take their last breath, I don't hear their socialization about amazing things at home. All of this. And it's just like, well, we need to change this message. We need to make sure they're safe, but we need to also make sure they're strong. And like understand the strengths of our community. And I think it's very hard to change that narrative without working with the parents too. And it's hard to do that when people that you're working with don't look like you, when they don't get it. Because no matter how culturally competent you are, there are only certain aspects you can get from walking around in this skin. That's just what it is. And I'm not saying, you know, knowing other people can't get it and educate themselves, but there's certain things that you just feel. There's certain things that you can't even put into words. Like as Black women, just being like, you know what I'm talking about, you know, just being like, you feel that. And it's it's also working with the parents to be like, I hear you and I see you, and this is totally valid. But can you understand that you gave your child 10 negative things about being Black this week, and they got one positive thing?
Definitely. And I definitely think it's one of those things that it is a lot of fear. And I think the fear has been there, like you said, for generation to generations. And media doesn't help, because now, it's good in the sense that we know, we see the injustices right away. We're videotaping them and we're aware of them. But again, how much of that is okay? Because if you constantly are watching that and I call it, there's a difference between being inundated versus being informed. And it's important to be informed. But when we have that constant 24-hour news networks now that you could just watch the same incident over and over again from different perspectives, discuss it 1,000 million different times, that can definitely increase that fear, and that's the research. That's not something I'm making up. That increases that fear. So I totally agree with you in terms of what are we watching, the screen time, but also having that balance and having those conversations about what happened to Ahmaud Arbery, Breonna Taylor, and George Floyd, and so on and so on and so on, right? Making sure we have that conversation with our children, even if they're young, finding that language and having that information as well. And I completely agree. I was sharing with my client, it only takes one person to start healing. So just like fear is contagious, so is joy, so is resilience, so is healing. So I totally agree with you, making sure we balance that out. But I think it's something that we have to be mindful of, because I don't know that as a mother, I have boys. I have nothing but boys, men, grown men. And I think that the African-American male's experience is much different in many ways than our experience, right? Both of them are tumultuous, but it's a different experience. And so I can remember having that fear with my sons, like having, that anxiety about what's going to happen when you get a certain age and, you're interacting with certain groups of people. So thank you for that, Dr. Joy. I'm sorry, Dr. Martin. Thank you very, very much. I called you Dr. Joy because your comment made me smile, made me feel good on the inside. I got a little bit of joy there.
I take that as a compliment.
It is a compliment.
I have no problem with that.
That was really good stuff you said. So you're back with us again, Dr. Washington.
I think we have a better connection, but we may have noise in the background eventually. But however, I will say this about fear. We know that Diaz and Resler did research on fear within mice and had mice that were shocked. As they were shocked, they would get a whiff of an orange blossom smell. The mice began to associate the orange blossom smell with the trauma of being shocked. Mm-hmm. And what would happen is that these mice would have pups that would not be shocked, but they would have the experience of the orange blossom, and their bodies would have a visceral response to the orange blossom as if they had been shocked. Mm-hmm. These mice would grow up and have pups, and their offsprings would have the same experience. That is, that they would smell the orange blossom and their bodies would have a visceral response. So when we talk about the idea of fear and trauma, we must recognize that there is an intergenerational pass down of content, of substance, from one group to the other. And it's easy to understand because if you understand that a female that gives birth to a female child gives birth to her own grandchildren because the eggs that will make her grandchildren are inside the child that she gives birth to. Right. So it's easy to comprehend then that the genetic material and memory of how to adapt and to adjust to given situations are contained within 3 generations, because when we exist, we are 3 generations back. So I'm a product of my grandmother and my mother concomitantly. So when we talk about trauma and the experience of Ahmaud Arbery, George Floyd, right, Breonna Taylor, it is not a new phenomenon. It is remembering. It is the means to go back, member joining. It is the rejoining of the old traumatized memories that have never been resolved, which is why we have to have the conversation again about persistent enslavement, systemic trauma, that it is ongoing. And it is a thing that deters us from actually getting to a space of liberation because we haven't stopped to analyze and assess that we do have some traumatizing experiences. And you mentioned early on about colorism. Right, yes. The pass down of a survival mechanism to navigate the incursions of European oppression. Yeah. So we have to understand that colorism is a function of adaptation to perpetual traumatization. So that if I have the tokens that will give me access to a given space. And that token could be color, that token could be hair texture, that token could be education, that token could be body structure, right? Whatever that is, if I can have the token to navigate this space, then I will not incur the trauma of this space. And so I talked about this in closing. I would say that one time I mentioned this to a group of students, and one student said, Dr. Washington, you're right. My mother named me Brittany because they did not want people to know that I was white. I mean, I was black. And so the issue is that I said, well, one day they would have to see your black self, right? But the idea was that think about this, the simple task or obligation or honor of naming a child is filled with trauma for how they're going to survive in a space. I want you to think about how deep that is, that our modality for operating and functioning is survival, which is why we cannot have post-trauma, because I cannot do therapy on a military soldier while we're having bullets flying over our heads, saying, how does it make you feel? Well, how do you feel about this now? Because the bullets are flying over our heads. We're in the middle of the issue. And so again, we talk about identifying the issue, the concepts. And I think, Dr. Martin, you were very clear in not just simply blackenizing the conversation, but having a grounded conversation within an African-centered perspective. Yeah. Like, how do I define this from my angle? Because when they talk about the slave trade, it sounds like swapping baseball cards. Yeah. But if I talk about the experience, it is as we say, the ma'afa, it is the great suffering of African people, right? These are clear things that we have to be able to identify for ourselves. We can't use their terminology to define our reality, because if we use their own terminology against them or on them, they would all mostly be narcissistic. It would be sociopaths. It will be psychopaths, because why? Think about, a sociopath will lie, will cheat, will kill, and have no remorse for it, right? And then blame somebody else for it. And if you look at European culture, have taken Africans, right? Human trafficking, lynched, took pictures around that, right? There's no remorse for the humanity of someone else. So in reality, if we analyze it, which we should do a better job as well, using their own terminology, but analyze it, we say that behavior is not human. Because it does not advance the humanity of others. We're afraid to say that because, well, what does that mean for my license? What does it mean for my practice? What does it mean for my white friends? So the issue is not about that. The issue is about defining truth. And that's where the healing takes place.
Yeah, and that's why they have to actively dehumanize it. You know, they had to say that we weren't if they identify the fact that we were doing this to other humans, right? Then
what would that make them? Exactly.
Yes, that makes you a society of individuals who systemically raped, pillaged, destroyed, and murdered families repeatedly. For hundreds upon hundreds of years, you made it law that you could do this to human beings. Not human beings who had less intellect than you, not human beings who were savages, not human beings who were just looking at ideologies and non-human ideologies. You were doing this to someone like you in the same race. You decided to do that, and it could have easily happened to you. Being raped repeatedly, murdered repeatedly, separated repeatedly.
So defamation of character. Apologies. Go ahead. Defamation of character precedes the destruction of the person. So the reason that we have the crescent roll, for example, is because the French army wanted their soldiers to see themselves devouring those who practice Islam with the crescent. And so they had them to create the crescent roll. So each morning they were devouring their enemy. So when we deal with war, Dr. Martin, you are on point. There is the imperative to have a defamation of character so that I can then destroy the person. So if I can suggest to you that the person is not human. The person is a nigger. The person is a bitch, right? A person is a hoe, and a nigger is non-human. A bitch is a female dog, right? A hoe is something that's manipulated for one's purposes. So the reality is that if I can make the entity non-human, the problem is that those who have had this verbiage bestowed upon them begins to identify with that dehumanizing position and own it as if it were their true, authentic self.
Nature. Mm-hmm.
That's the problem.
Yeah, that's the racist and socialization. That's the internalized racism, every single aspect. And the fact that they made a conscious effort to do that. They made sure that they had doctors who said that their skull size was smaller. So, they couldn't understand it. It wasn't, I think it's really important to identify the language and the fact that this aspect was brought on by society, laws. You have publications that you can go back into and say that, these people aren't humans. We have Dr. Sims, who is seen as the father of obstetrics and gynecology, who decided to do his work anesthetize on Black women so that we can anesthetize white women. And why do they need it? They feel pain differently. And this isn't even that far back. There was a study, I think 8 to 10 years ago, where physicians, residents were tested to see, what are your perceptions of pain for Black people? And these are people who are going to be our future physicians, thought that we experience pain differently. It's not even, you could go back to research a year ago, and this isn't like articles or blogs. These are,
it's the truth.
American medical.
But a couple things. Dr. Washington, right, it was systemic. Dr. Washington pointed out some things about a mother carrying a child and a female child, and also in essence is carrying her grandbabies, right? Mm-hmm. So that speaks to epigenetics, I would say, right? Mm-hmm. And again, we're looking, this is that passed down from generation to generation, and the experiences that we can continue to harbor within our bodies and then give that off to our offspring, And so I definitely hear what you're saying in terms of the mindsets that they have, how it impacts us, how they see us, and also how we see ourselves, and breaking those belief systems early on. And so we have about 10 minutes left. I wanted to, Sister, I know you wanted to jump in, so I want to hear what you have to say, but I also wanted us to kind of start to look at what are some intentional steps that we can take to begin the healing process. Because I think I want to also bring up that persistent piece, how you explained it, how you broke it down, Dr. Washington, makes a whole lot of sense, makes a whole lot of sense in terms of, we're treating something that's actively going on. So it's not post. We're doing damage control in essence, because we are witnessing the same thing across the world over and over and over again. And it doesn't seem to matter.
It's global.
Yeah, exactly. Mm-hmm. Exactly. Go ahead, sister. Jump in.
Yeah, thank you. Yeah, I totally agree. And to come again to this point that we understanding the situation as it is something which we're doing through webinars and online Zoom conferences like this, mm-hmm. is that we realize we cannot rely on the system to bring about any form of transformation.
Exactly.
So we have to do it. We have to start by educating ourselves, right to the core unit of the family, that Black families understand the situation, what is going on. From this understanding, from the telling of the truth, already is the first stage of healing, understanding the situation.
Yeah.
So often I still hear a lot of negative talk about Black people, from Black people. Mm-hmm. Oh, we are lazy. Oh, we are this. We don't treat our children right. So there is still a lot which is not understood about ourselves, not understanding that the Black child was in danger outside of the home. And we have passed this through our generations out of love to be careful. So when here in Germany, when I go somewhere and I see white kids playing, they're all over the place. Mm-hmm. Under the table there, they're free to explore.
Yeah.
And when I watch the Black kids, the mothers are like, oh, come here, stop that, don't disturb, don't this, So it comes from somewhere, out of this wanting to protect our child, because almost every move was a danger to their lives. And in a way, it's still like that.
It is. Yeah, it's still like that. I would say it's still like
children, that. Exactly, are not free to explore.
Yeah.
from telling the truth and then coming back to our origins, to our heritage. We are a people, our history did not start with slavery. And the Eurocentric ways which lead to dehumanization and destruction have to be overcome. And we are the ones to do this job. We have to move back to our ancestry and regain the knowledge of ourselves in order to change behavior and take action. So I think it's important that we start to reflect on our behaviors and we start to heal ourselves. A healer cannot heal himself, we say in my language. So we need each other, and we have to make this collective organization. Organizing together is so important. And these are the steps which I think are important, that we start to pull on these in African indigenous ways and knowledges which are there, honoring our ancestors, recalling their histories. When we honor them, we call on their histories, we tell their stories, we draw from their power.
Awesome.
And that's why I'm so thankful for such for our organizing together like this. It's so important. And so we see it's not a globe, it's a global problem. And the solution is also us as Black people collectively.
Yes, it is. This platform provides such a connection. It's so empowering to be with other African Americans, other people, Black people, to be able to talk about these types of topics and to be invested in the literature and the research and know what was happening within our people, versus what we're being taught to think.
Exactly.
It's such a powerful thing. And you walk away feeling like refreshed,
Exactly.
I totally agree. Dr. Martin.
Yes. Recommendations?
Yes. Yep. Some intentional healing. I love what Sister said about recalling the stories of our ancestors. That thing just resonated right here for me, right here. That felt real good. What else you got?
I would say continue on with that, like active racial identity development, like, educating your child on purpose.
Yes.
One of my best friends told me, it's important to have a good day on purpose. It's important to educate your children purposefully, not only when it comes to aspects of, you got reading, writing, and arithmetic, but what about who you are as a person and where all your values come from? I think there needs to be more information about values within a collectivist society, or just value development and how that guides who you are as a person.
Yeah.
So if you value integrity, and if that's something that's passed down, how does that impede upon the decisions that you're making every day? How does that help you rear a child? But also when it comes to mental health, because I am a psychologist, to go to therapy.
Yes, definitely.
Please.
Yes. And how the conversation is.
Just realize there's nothing wrong with having a preference in the clinician that you are working with and that you are paying to help you. Period. You can have a preference for age, race, and ethnicity. You can have consultation sessions before you even meet with your clinician, and you can ask, what are your sliding scale fees? What are your hours? What is your opinion on the implications of the systemic oppression on Black mental health?
Right.
That's an appropriate question to ask your clinician. Because if you're coming into therapy and you're going to have some aspect of stress regarding the environment that you're in as a Black person, you need to know what they think contributes to that stress.
Yes.
As a clinician, what do you think contributes to Black stressors? Ask that.
I would ask those questions to Black and non-Black therapists, because Dr. Washington brought up, that we have some, and so the sister, we have some Black people out here, African Americans, people of color out here that think that this whole persistent slave syndrome thing is a crock. They don't feed into it. We just need to pull ourselves up from the bootstraps and the X, Y, and Z. So I would ask those questions to both Black and non-Black therapists, because I need to know where we at. Are we on the same page in terms of what our country or what this world is doing to people of color? Because we do have people that don't believe.
And I don't get a free pass just because I'm Black. My experience might not be the same as you.
Exactly.
No, and I don't, people will say, pull yourself up by your bootstraps. And it's like, oh, I didn't even get boots. So I don't know what you're talking about.
Exactly.
Right, and that's where a lot of people are coming from. Yep. So don't just assume that I'm Black. I understand your experience, because cultural competence doesn't only refer to race. There's a generational aspect of it.
That's right.
There's the aspect of where you're coming from,
you live at,
from East Coast versus down South versus the Bible Belt versus, they have different access to things, so they may not see it the same way. Don't assume that I get a pass just because I'm a Black woman. Don't assume that I understand where you're going through because I'm a Black woman. You need to query everyone. Exactly. Nobody gets a free pass.
That's right. Especially when it comes to your mental health and your treatment, So we only have a few minutes left. I want to make sure we get, thank you so much, Dr. Martin and Sister. Those are some excellent reminders, things that help resonate with where we need to go, what directions we need to go into, because we want to leave people with the healing tools. Like we talked about, healing is contagious, joy is contagious. So we want to leave them with that. But as we're wrapping up, I want to give Dr. Washington, and I'm sorry how to say your last name, Dr. Kyrie. Am I saying that right?
You said everything correctly. You on point.
Okay.
you were Dr. Croissant. You were on it. Thank you for everything. I didn't tell you thank you for what you've done. And I thank you for your scholarship over the years. So I appreciate you for that.
Thank you. Mm-hmm. Did you want to add to our intentional healing pieces?
So the idea here is clear that there has to be an intentionality around our healing. The idea of inoculation. If you think about a vaccine, the function of a vaccine is to be able to inoculate one from the incursion of the phenomena. So we have to expose our children, as Dr. Martin said, to the content of what they're encountering. And the sister said that we also have to give them an infusion of who they are as a person beyond the enslavement experience. Too many times we define ourselves in the context of reacting to a traumatic experience, but who are we at our core, and who is doing the reacting? Who is responding? Because we have to be clear about our essence, because our essence is what it is. So we have to also have affirmations of the socialization process that was mentioned earlier, socialize people into knowing this is who you are at your core, no matter what it is, no matter what I did. My grandmother says, and I know you know better, right? Yes. Whatever it was, she said, and I know you know better. Now she didn't, how does she know? She knew that in me was something greater than what I displayed. And so we have to then also have that knowledge that beyond reacting and responding to racism, and also the idea of socialization, but also the notion of who are you at your essence, and what is it that they come to attack? See, the reason why somebody keeps coming to attack you is because they haven't won yet. See, once you have the victory, you're done. Mm-hmm. But the reason why they keep coming back over and over and over again is because they haven't won. The thing that we have identified clearly as a people. Now we know it here on this panel, but we've identified as a people. What is it that they cannot destroy? Mm-hmm. They cannot destroy the essence of who we are, because where we have come from is something greater than what they try to understand. Because we know that we are a seed of a seed of a seed of a seed of the seed, which means inside of it is the essence of all that has been and all that will ever be. So we have to have a ritual that remind us of this. And I will close by saying this, Dr. Arun. This is interesting because I had a conversation about spirit and ancestors with a brother here in the Gambia. And he was so enamored or indoctrinated into Arabized Islam that he said that the ancestors don't exist. They in the past, there's no thing called spirit. It's all Allah, right? And so we have to be able to challenge ourselves to see where we have been indoctrinated to be to disidentify from ourselves, to become unlike ourselves, but still use our essence to inform us on how to do that practice. And that means that we have to interrogate not only our education, interrogate our clients and therapists, we must interrogate our BS, our belief systems. We interrogate them to see if they are informing us of how to be the best that we can be. That is the idea of the healing work. And so we are here, and I want you to know that I'm completing the book on persistent slave systemic trauma. I've been writing and stopping and writing for years, but I want to talk about the issue of persistent slave systemic trauma and how to heal from that, which is a Ubuntu psychotherapy that we talk about, which is the affirmation of African humanity. So that is the plug I would put in.
Awesome. Well, I cannot begin to tell you how wonderful of an experience this has been. We are closing. We're going to wrap this up because we're moving into our next segment of the breakdown. I thank you all for your intentional pieces on how to start the healing process. And we just want to now just take about 30 seconds per person and just give some final comments for the audience so that we can make our way into the next segment. How about we start with you, sister? Let's hear from you first.
Yeah, so thank you very much again for this opportunity. And I remind again that today is Africa Liberation Day, and that we recommit on this day to the collective liberation of our people.
Love it. Love it. Dr. Martin.
I would say be active in the way that you rear your children, but don't think that rearing anyone stops with just you, just because you're an adult. Be active and intentional. I see so many things about manifestations, but you need to back up those manifestations with action to figure out how you're going to actually act on the opportunities that you want, and be mindful of that and identify your values. Because we never, we always ask what you want to be when you grow up. We never stop growing.
That's right.
We should never stop learning about ourselves, our history, our surroundings, all of that. You need to be intentional in everything. It's all about evolution. Evolve who you are as a person.
Thank you. Thank you for that. Dr. Washington, Cardi.
So the true healing work comes in when we recognize that we are divinely inspired to be here. I think that we stop and we ask permission too many times to exist. But when we begin to take agency and say that I know that I'm here for a purpose, it begins to lead us into better spaces to ask better questions, to get better answers. So we must discontinue asking for permission to exist and affirm ourselves in knowing that we are authentically created for this moment. Every moment is purposeful. Every moment is ordained. Every moment has in it something that is sacred. And so we cherish each and every moment. And even us as a moment of inspiration of two cells coming together inside of a womb that calls a light to flash. Our liberation comes not from someone else. Our liberation to be who we are came prior to our creation, but inside the womb, when that flash happened, that bang happened in darkness, the question becomes, what powered the light? And what powered the light was the source that gave us that light. So I don't have to ask you, can I exist? I don't have to ask permission. I simply stand in it. And that same light that gave rise to the fingers that formed inside the womb, and I had nothing to do, that gave rise to the legs that formed, and my body had nowhere to walk. That gave rise to every organ of my body, yet I was not using any of them. That same entity is the same one that knows exactly where I should go. I must be able to submit to that and know that every moment that we have is a purposeful moment, and that we are a moment of divine inspiration.